Hi Kirsten, this is John. I reviewed your unit of instruction and found it to be flawless. I really thought that the way that you put it together with the help of a professional version of Zuno was spectacular. I'm just going to go through each section as described in the template and tell you why I graded the template as I did. First, it says that the instructional problem can be corrected with education. Well, the problem is stated in the title, postpartum hemorrhage of maternal obstetrical complication. And that's going to be for OB nursing. Okay. Where this is a complicated birth, this is something that these nurses will certainly need and best be prepared for with a unit of instruction such as this. You provide a clear course description. For example, using hybrid format, giving the students reading assignments prior to the simulation part of the class. Your unit of instruction is designed to increase the knowledge of the new labor and delivery nurse and to recognize and intervene appropriately during the occurrence of a postpartum hemorrhage. This is something that new nurses are going to want to know. They're going to be anxious about being in a position like that and how they might respond, and this type of education unit is helpful to them. The fact that you're using high-fidelity patient simulation in a team scenario has proven benefits by improving knowledge, skills, and attitudes of both new nurses and experienced nurses. So that was very nicely done. You introduce yourself. And state your availability so that students know that if they should have any questions, you're easy to reach. Okay, this is a very nice graphic. Okay. Of a simulation. Okay. And this helps prepare the students to engage in the class, knowing what they'll be participating in. This next section here also uses a nice graphic to depict what a normal condition is of the uterus and what an abnormal situation might be that leads to serious complications. You list your course outcomes clearly. For example, demonstrate the proper knowledge of how to manage postpartum hemorrhage and recognize risk factors of postpartum hemorrhage, as well as how they will be evaluated, okay, through direct observation by the instructor, so on and so forth. Okay. You have your Voki. Connection works very well. And then we go over to the to-do list where you provide them with a case study to be done prior to class so that they can meet with small discussion groups and discuss the appropriate care of a postpartum hemorrhage patient prior to the high-fidelity simulation. Also, to review articles on postpartum hemorrhage, and you provide them with those resources with several videos in your resource section. And all these videos were very informative, as were the case studies. In your discussion question, which is more like a case study, it's a very good question. And it gives learners an opportunity to reflect on what they might do with this new knowledge. In your assignments section, again, very nice graphic. And your use of the VoiceOver PowerPoint also demonstrates the focus on the topic question of postpartum hemorrhage. In the wrap-up section, you review what you've learned, the physiology, the clinical symptoms, interventions and treatment, and how to function as part of a team in a high-fidelity scenario. You encourage the learners to put their learning into practice, to work as a team, to seek out resources when they realize that they are having an emergency, which is a very important step. Sometimes people get too deep before they ask for help, and just makes the problem worse. If they have any areas that need reinforcement or practice, you let them know that this is the type of education we want. We want somebody who is open to issues as they occur. Next, in your evaluation section, the rubric depicts various levels of understanding and participation, starting with the lack of participation to being an active participant in the team assignments. I've noticed that in simulations that there are definite leaders who take charge of the situation, and there are those that stay off to the back. Given the opportunities to switch, these students might find themselves more talkative. As instructors, we can rotate those leadership positions during the scenarios. Active participation in the simulation, development of their discussion question, and the appropriate of knowledge. So I thought that the rubric was very good. In the quiz, sad to say I got a 70. I messed up with the second question. Where do a pelvic exam during the postpartum bleeding, but all of the questions were appropriate. I'm sure that if I had a little remediation, I would also get 100. In the reflection section, okay, the questions were very thoughtful, asking learners to look at what they have learned and how it's going to enhance their understanding of the postpartum hemorrhage, and also asking them if they're more comfortable that they have this knowledge and if they feel that their teamwork skills in an emergency have improved. My experience in simulation is that students' skills will improve. A little education and some instruction, and they improve greatly. I'm sure that you will have the same experience as well. You ask, did your scenario help bring this curriculum to life for you as a nurse? So again, these are very good questions. I see that you added a self-reflection on the unit of instruction. I'm glad that you got fired up about the teaching. It is a very user-friendly platform. I enjoyed Screen-O-Matic, and I'm glad to see you going to utilize it in your future teaching. So that's my teaching, my technology challenge for this week. This is my fourth take, little technical issues, but I'm very happy to have had the opportunity to review your unit of instruction. Like I said, it was exemplary, and it helped raise the bar for me as well. So good luck with this unit of instruction.